Good evening, everyone. Myself, Dr. Pradyot, Director of Movement Maestro Academy. Welcome you all to our fifth e-seminar of Movement Maestro Academy. Our today's session is on antenatal and postnatal rehab. For today's session, we have our renowned research person, Dr. Binal ma'am, who is a lead women health physiotherapist at Aquatic. Over to you, ma'am.
Thank you for your kind introduction. I'll start sharing my screen. You will have to give me access to share screen, Dr. Pradyot.
Yes, ma'am, done.
Yeah. Is it visible, Dr. Pradyot?
Yes, ma'am.
Okay. So today's topic we are going to discuss exercise. Yeah. So today's topic is exercise during pregnancy and postpartum. I'm Dr. Binal Dave. I'm a women's healthcare physiotherapist, childbirth educator, lactation counselor, and a pelvic floor rehab specialist. So we'll just see a glance of how exercises during pregnancy and post-pregnancy are important. So let us understand the physiological changes with pregnancy. So we see quite a lot of soft tissue edema, which is reported approximately by 80% of the women in their last 8 weeks of pregnancy. There is increased fluid retention, which can cause nerve entrapment, especially the carpal tunnel syndrome. Plus, we see ligamentous laxity because of the hormone relaxin. So it will remodel your pelvic connective tissues and it will also activate cholanogynolactic system. So initial increase in the relaxin levels peaks at the 12th week and it will decline by the 17th week. So 20% of increase in the weight during pregnancy may increase for the joints by 100%. So very important aspect to keep in mind the exercises you are giving to the pregnant women. Hyperlordosis, which will ultimately give an anterior pelvic tilt, that's one reason of the lower back pain. So that also is to be taken care of. So you have to give them quite a lot of posture exercises. That's why vestibular ball exercises, you will see nowadays everybody sitting on a ball and exercising. This is the reason, because it helps you correct your structural lordosis. Symphysis pubis widening begins from the 10th to the 12th week of pregnancy because of the hormone relaxin. So in the image you are seeing, as and when the belly size increases, there's an exaggerated lordosis which comes into the picture because your lower back extensor muscles go into shortening position and your abdominal muscles tend to stretch. That's one of the reason, and that's a physiological change. And so before you are starting your exercises, you have to make aware your client that this would be the changes which Now let's understand few more anatomical and physiological changes. About 60% of pregnant women experience low back pain. That's why strengthening of the abdominal muscles and back muscles is to be given to reduce these changes. Respiratory changes, decrease in the pulmonary reserve. So ability to exercise and aerobically is impaired. So oxygen availability for strenuous exercises decreases. And aerobic training increases aerobic capacity, and it will also reduce the weight gain. So only the normal weight gain is seen, that's the baby weight, and little bit more weight in a woman. Temperature regulation, so you have to stay well hydrated. You should wear loose fitted clothing. Avoid exercises in high heat and humidity to avoid heat stress. Decrease arch height, so avoid running or walking on an uneven terrain because it is difficult to adapt. Wear supportive shoes always. Orthotics is an option for those who have flat feet or exaggerated arches. Orthotics can also be prescribed. Why you should exercise during pregnancy? To maintain your physical fitness, to help weight management, reduce risk of gestational diabetes in obese women, enhance psychological well-being. It is safe and desirable. So the recommendation per week is 150 minutes moderate intensity aerobic activity, which is equivalent to brisk walking. Also, you can use a talk test to see whether the client is able to tolerate the exercises. So we will understand the talk test. So whenever you give them exercises moderate intensity, and when you are talking to them, they should be able to talk to you. And because of the gasping of breath, if they are not able to talk, then you have to reduce your intensity of exercise. Physical inactivity and excessive weight gain will also give maternal obesity, gestational diabetes, and other complications. That's why exercise is important. What are the safe and unsafe physical activities? Activities to initiate are walking, swimming, stationary cycling, low impact aerobics, modified yoga positions, running, jogging, strength training. And which activities you should avoid? It is contact sports like soccer, basketball, activities with high risk of falling, that is road cycling, power yoga, very strong Pilates, body weight Pilates should be avoided. There are specific Pilates exercises for pregnant ladies that can be incorporated. What is the recommended exercise frequency and duration? According to American and Canadian guidelines, we should encourage women with uncomplicated pregnancies to participate in regular aerobic and resistive exercises. Previously, those who were sedentary women, they can exercise aerobically for 15 minutes 3 times in a week. They can take it up to 30 minutes 4 times in a week. Women with uncomplicated pregnancies can do moderate intensity. Rate of perceived exertion is a scale. So on a rate of 12 to 14, you can give them exercises. Resistance, flexibility training, and aerobic exercise individually or in combination can be given. So 30 minutes per day, 4 to 5 days in a week is ideal recommendation. What are the absolute contraindications to aerobic exercises during pregnancy? That they are hemodynamically having a heart disease, there is a restrictive lung disease, there might be incompetent cervix, circlage, which is the opening of your vaginal canal, the uppermost, multiple gestational at risk, and they might have chances of premature labor. Persistent second or third trimester bleeding, then it's an absolute contraindication. Placenta previa after 26 weeks of gestation, premature labor during prior pregnancies, ruptured membranes, preeclampsia or pregnancy-induced hypertension, severe anemia. These are the absolute contraindications to aerobic exercise during pregnancy. What are the relative contraindications to aerobic exercise? Anemia, unevaluated maternal cardiac arrhythmia, chronic bronchitis, poorly controlled type 1 diabetes, extreme morbid obesity, extreme underweight, BMI less than 12, history of extremely sedentary lifestyle, intrauterine growth restriction in pregnancy, poorly controlled hypertension, orthopedic limitations, poorly controlled seizure disorder, poorly controlled hypothyroidism, and if a client is a heavy smoker. What are the warning signs to stop exercising when you are pregnant? One is vaginal bleeding, regular painful contractions, amniotic fluid leakage, dyspnea before exertion, dizziness, headache, chest pain, muscle weakness affecting the balance, calf pain or swelling. Avoid all those activities which makes the pain worse. So standing on one leg, bending and twisting, crossing legs, sitting on the floor, sitting twisted, sitting or standing for long periods of time, lifting heavy weights like grocery bags or vacuum cleaners, carrying anything in only one hand because of the hormonal levels. That's a relaxant. So, what do you do during pregnancy? Be as active as possible, avoid activities that make the pain worse, rest when possible, may need to sit down more often, wear supportive shoes, keep knees together when moving in and out of the car, rolling in and out of bed, sleep in comfortable position, take stairs one at a time, upstairs leading with less painful leg, downstairs leading with more painful leg. What are the benefits of exercise postpartum? It will improve your cardiovascular fitness, facilitate weight loss, increases positive mood, decreases anxiety and depression, more energy following exercises, decrease lactation-induced bone loss. It will decrease urinary stress and continence because we give them good amount of pelvic floor exercises. Weight retention postpartum. So mothers with normal weight prior to pregnancy and those who gain the recommended weight during pregnancy will require intervention postpartum. Mothers with additional weight gain in the postpartum period are more susceptible to long-term weight gain, more likely to have related diseases like obesity, heart disease, diabetes. So decrease postpartum weight retention. You have to increase the physical activity to maintain your lean body mass, enhance your fat mass, improve your aerobic fitness. Weight loss of more than 1.5 kg is not recommended for lactating women. Now let's understand why strengthen the pelvic floor muscles. Urinary stress incontinence is common in 30 to 60% of pregnant women. 15% of postpartum women have it 3 months after delivery due to the pelvic floor trauma due to the vaginal delivery. So what is the intervention? We strengthen the pelvic floor muscles. Pelvic floor training program is perform 8 to 10 maximum pelvic floor contractions twice in a day, 3 times per week. Hold the maximum contraction for 6 to 8 seconds, adding 3 to 4 fast contractions at the end of each maximal contraction. So this is a view of your pelvic female pelvis. It's the superior view. So this is the pelvic diaphragm, which is the deepest muscle layer. So you can see your pubic symphysis in the front, your lumbar spine in the posterior region. You can see obturator internus muscle. You can see your tailbone. There are levator ani muscles, coccygeus muscles, urogenital diaphragm, which consists of urethra, vagina, anal canal. You can see your pubococcygeus and ischio-coccygeus muscle, which is together named as levator ani. So, how do you look after your baby? Considering your posture and your body. So, change diapers at waist height. Do not lift baby too often. Carry baby in front of you. Don't carry baby on one hip. Kneel at the bedside rather than bending over. Keep your baby close to you when moving them in and out of the car seat. If you have to carry baby in car seat, hold it in front of you, not on one hip. Don't lift baby out of high shopping trolleys. Do pelvic floor muscle exercises daily. So the effect there, this is a systematic review done on importance of core and lower limb strengthening on pregnancy-related lower back pain and pelvic girdle pain. So the biomechanical stresses are there, of course, because of the change in the pelvis and spinal alignment. There is joint laxity and there is weight gain. You will see muscle weakness of the proximal hip muscles, abdominal muscles, the lumbosacral region may contribute to impaired core stability, thus altered alignment. So decreased ability to withstand stress and disruption of normal gait pattern. You will see the gait pattern also changing in pregnant women. So pregnancy-induced pelvic girdle pain is pain of musculoskeletal origin between the levels of posterior iliac crest and gluteal folds, involving the anterior and posterior aspects of the pelvis that may radiate into the posterior thigh. So what is the intervention? We will do activity modifications. We will add up exercises for the same. We will focus on joint and soft tissue mobilization. Aquatic therapy is very important. Acupuncture is one of the alternative therapy, bracing and positioning. Which muscles you will strengthen? The local stabilizers, especially the transverse abdominis, it is more effective to reduce the laxity of the lumbopelvic and sacroiliac joint than the global stabilizers alone. So you will have to do individual muscle activations along with the global stabilizers. So intervention, land versus aquatic exercise. So what are the benefits of aquatic exercise? It will decrease joint compressive forces because once you are in water and you are immersed till the chest level, you will have 1/10 of your body weight, which you will feel. And it also improves your edema. It increases the blood volume and cardiac output. It will improve the control of weight gain because you can exercise with a higher intensity in water compared to land. You will have decreased back pain. So, of course, the exercise output will increase. You will reduce postpartum depression if you are coming for postpartum aquatic therapy, and muscles are relaxed. So, in this image, you are seeing is a passive relaxation technique named Watsu, which a pregnant lady is taking currently. It will relax all the joints, all the muscles. So also we do quite a lot of pelvic rocking movements, pelvic girdle movements, lower limb movements, which induces the relaxation. And also we have seen in cases that the first baby kick or the baby movement is felt in water because there is no gravity. And with the help of the properties of water, you feel the baby movements better in water. What are the other exercises which we give on land? It's the pelvic floor and the core exercises, as I mentioned. So there are different cues which we give to contract pelvic floor. Try to hold in the gas, pull your belly button towards the spine. So that's the combination of pelvic floor and core. What's the purpose? It helps to stabilize your SI joint laxity, which is very common during pregnancy. There are certain exercises which I have mentioned here. So these are quadruped pelvic tilts. All of us are very aware of the cat and camel. So what's the purpose? It is to facilitate and maintain a neutral hip position. Clamshell. So it's for increasing your hip strength and stabilizing your spine. Deep breathing exercises, especially the diaphragmatic breathing, it will facilitate deep core muscle activation, and it is also a relaxation technique. You place one hand on the chest, one on the belly, and you breathe in through the nose slowly and deeply. The hands on the belly should be the one that is moving. Breathe out through your mouth and perform this exercise slowly. So here are the resources from where I've taken all the studies. So you can go through the resources. Yeah. For further questions and queries, we'll be coming up with a detailed webinar in future. So please connect in case if you have any doubts. Yeah, over to you, Dr. Pradyot.
Yeah, ma'am. Thank you so much for the informative session.
Thank you.
And thanks a lot, ma'am, for your valuable time. And thank you all the participants for joining with us. For the brief session, definitely you can join with us on this topic. And we also have running the fellowship courses on this. So thank you everyone. Good night.
Thank you.